Thank you. I am going to attempt to share my slides here. Nope, I don't think that worked. Did that work?
We can see it. We can see it, yes.
Okay, excellent.
Yes.
Thank you. All right, well, thank you so much. I'm really excited to be speaking to you all today. Just move my little face to the side. Yeah, so thanks for everyone. This is going to be, after listening in on the past few talks, a different talk, absolutely. So I, as was introduced, I'm Bonnielin Swenor. I'm associate professor in the Department of Ophthalmology, is a hard word to say. I am also the founder and director of the Johns Hopkins Disability Health Research Center, which I'll talk about in a second. I'm an epidemiologist, so I also have a joint appointment in the epidemiology department at the School of Public Health. So the Disability Health Research Center, I'm going to start off just by describing what that is, because that's sentinel for what I'm going to talk about today, is really invested in addressing health inequities for people with disabilities. The idea here, the catchphrase we use, is changing the paradigm from living with a disability to thriving with a disability. So we do work that you can think about as putting disability on the other side of the equation. So as my colleague, Dr. Pickett, just described, he mentioned disability a few times in his discussion as the outcome. We're interested as disability as the starting point. We want to know how people with disabilities can age well, can be included in society, and to think about that in a really holistic way. So what I'm showing on this slide is a Venn diagram of disability and aging. So throughout the life course, whether you have a disability at birth, in midlife, or later in life, and equity and access, which are key components to achieving those goals. So today, the science of diversity is the topic, and I want to just start with having everyone pause and think for a second around why diversity in science and medicine really is important. For me, it's all about perspective. So on this slide, what I'm showing you is two individuals on either side of a number on the ground. One sees a 6 and the other sees a 9. The idea of that is to portray this idea that we all bring to the equation, to our science, to our daily lives, our unique perspectives. And in science and medicine, that impacts the way we see the data, we interpret the data, the importance of the data that it brings to us, it matters. And that's what diversity is all about, is making sure that we have a broad array of perspectives at the table when we are working with data, when we're doing science, when we are taking care of patients. Disability, unfortunately, is often not part of that diversity equation in science and medicine. There's been many efforts around diversifying, but disability just has fallen through the cracks. Disability is not uncommon, however. 1 in 4 American adults has a disability. And so this makes it a really important group to think about and to include. Disability is, in fact, the largest minority group in the United States. It's the only minority group that anyone can join at any time. So I know that when I say disability, sometimes that means different things to different people. So what I'm showing on this slide is a bar graph of the prevalence of disability. So that 1 in 4 translates to 26% of American adults living in the community. And I'm showing the breakdown by mobility disability, cognitive disability, independent living, hearing, vision disabilities. But you can think about disability as any condition or impairment that impacts daily lives. So that can include people with vision impairments, or people who are blind, people who are hard of hearing, or people who are deaf, individuals with dementia, those who are autistic, people with cerebral palsy. This can also include people with migraines, people with depression, people with anxiety, people with diabetes, when it impacts their daily life. for many people, there's a moment sometimes of realization of just how broad the umbrella of disability is. And it is a social construct like race or gender identity, meaning people identify as having a disability. That's the modern view of disability. But although disability really is quite common and broad and heterogeneous, there's many unaddressed health inequities for this group. So on this slide, what I'm showing is some infographics of data from the World Health Organization, just showing some information around that. So it's showing that people with disabilities are more likely to find healthcare providers' skills inadequate, their facilities inaccessible. They're more likely, 3 times more likely to be denied healthcare, and they're more likely to report poor treatment in healthcare settings than people without disabilities. Additionally, people with disabilities only half of people with disabilities can afford healthcare, and people with disabilities are more likely for healthcare costs to put them in poverty. So I'm going to pause here for a second and disclose that I come to this work because I myself have a disability. I have a vision impairment. I have a visual disability. I've been losing my vision for the past 15 years. And that's really the reason that I do this work. And so, although my day job is studying and addressing health inequities for people with disabilities, there's another important side of this equation, which is who we include in science and medicine. And people with disabilities have largely not been included as researchers and as clinicians. And we know from other groups that that is a critical part of closing health inequity gaps. So on this slide, what I'm showing is a bar graph of data that's part of a prevalence study that I collaborated with Dr. Lisa Meeks, who really is a leader in disability inclusion in the medical setting. And it's showing the percentage of medical students who reported disabilities. It's showing an increase from 2.7% in 2016 to 4.6%, almost a doubling in 2019. So while that certainly is really great news, that 4.6% is abysmally far below that 26%, that 1 in 4 Americans with a disability, true underrepresentation. On this slide, I'm showing another study by Dr. Meeks, which is fairly hot off the presses. It's data from a nationally represented sample of practicing US physicians, showing only 3% reported a disability. Again, underrepresentation. And on this slide, I'm showing data from a study I published a few years ago on data from the NIH, the National Institutes on Health, which is a federal funding agency. I'm sure most of you know this, but just to be clear, that is the largest funder of research. I'm sorry, I realize this is a little bit cut off, but what we showed is that the percentage of NIH funded researchers reporting a disability declined from 1.9% in 2008 to 1.2% in 2018. So not on a good trend, and again, far, far below that 26%. I know sometimes when I present this data, there's internal pause for some of the audience around, well, people with disabilities, can they really be researchers and clinicians? And I challenge you to think about that, right? I hope I am evidence, and there's many of us out there showing otherwise. We certainly can be. But there's important barriers to including people with disabilities as clinicians, as researchers, as part of research studies, engaging the disability community in this space. So the first is all about accessibility. And this is accessibility of physical spaces, virtual spaces, and even social spaces. Really remains to be a large barrier for inclusion of people with disabilities. Because so many people, because of the large underrepresentation of people with disabilities in science and medicine, that accessibility component tends to not be thought of or tends to be an afterthought, particularly on the side of the equation of the researcher or the clinician, because the common thought is that, well, of course, people with disabilities aren't researchers or clinicians, and that's what we really need to change. We also need to think about misperceptions or misconceptions around disability. This is all about stigma. This is all about thinking that people with disabilities are lesser. To some degree, in the space of medical settings or healthcare, it's the notion that disability is the antithesis of health. The idea is that you cannot be healthy and have a disability at the same time, and we need to change that. I myself think I am a very healthy individual. I have a disability. We need to start to change that equation. We need to focus on how to maximize health for people with disabilities instead of putting disability always at the end of the equation where it's the end stage, it's the last stage. Because by always doing so, we perpetuate these inequities. And when you already are there, you're already a person with a disability, there's little effort, little funding, little support, little focus on what to do next. And the argument that my center makes, that I make, is that you still can have a valuable, healthy, full life with a disability. We also need to change the idea that people with disabilities are excluded from diversity and inclusion efforts. Again, this is perpetuating these barriers, and it really is missed opportunities to allocate resources and opportunities for change, both as people doing the work, but also as opportunities to include who's in our studies. When we're thinking about diversifying who's part of your sample, who's part of your study, we also need to think about disability. So I want to press you all for a call to action on what you can do to help break down these really important barriers. Media and journalists really are key critical partners to this work. You magnify our efforts, you help give us traction to everything that we do. And so my first ask is around accessibility. Ensure your content is accessible to everyone. That includes online information. There are resources out there to help check for that. For those of you who aren't aware, I'm giving one option, WebAIM, it's just one. And I give this option because WebAIM is a strong partner of the Disability Health Research Center, and they're a fantastic resource. Also consider the physical spaces that you're involved in or you're around. Are they accessible, right? And this should not be, accessibility should not be considered an extra or an afterthought, but instead considered a necessity, a priority, starting from when you're building something. If you're involved in something or you're in a space, it's not accessible, say something, do something, even if you yourself don't have a disability. Understand language. This is so critical. I often see words in the media, in science, quite frankly, in the literature, scientific literature, to describe disability or people with disabilities that are euphemisms that really have antiquated and negative connotations, such as differently abled. That is not an accepted term in the disability community, or handicapped. We need to stop using that language. Disability is not a bad word. People in the community embrace that word. Now, I recognize there is difference, right? Not everybody appreciates the word disability. And on top of that, there is heterogeneity, much like the umbrella of disability is broad. Some people prefer disability first language, right? So I'm a disabled person versus person first language. I'm a person with a disability. So it's important when you're writing about disability to know the audience, to know that community, to know the language to use. And so I am giving on this slide another resource that's excellent, the Center on Disability and Journalism. For those that don't know, it is a very in-depth resource around, it's a style guide around disability. That's just the tip of the iceberg, quite honestly, what I just described. There's much more to know and understand about language within the disability community. And then lastly, include disability. So what I mean here is to ensure that the perspectives of people with disabilities are included in stories on issues related to disability. even if the issue is about caregiving or home and community-based services, actually talk to the person with a disability, not just the caregiver. That's critical to the disability community. The other comment I want to make is that disability intersects with all of our communities. It really is common. It's a part of all of our fabric. So when you're considering diversity and equity issues, consider disability as a key component of that. So what I'm showing on this slide is a link to a Lancet Public Health commentary that I recently wrote related to that, including disability in all health equity efforts, an urgent call to action. So it's really about the urgent need to include people with disabilities and to include disability in our efforts as scientists, in our work, in advancing health equity. And just to close, to hit it home, including people with disabilities in science and medicine as researchers, as clinicians, as part of our studies really is critical. It's necessary to advance health and equity for everybody in our communities. You can learn more about the work that we're doing. This really wasn't a science-heavy talk. We're doing lots of science-heavy work at our website, disabilityhealth.jhu.edu. You can follow us on Twitter at JHU Disability. We also have a podcast. I'm going to make a shameless plug for that at Included Pod. Thank you so much.
Okay, thank you very much. So moving to questions, David Shapiro asks, Dr. Swenor, when it comes to looking at the size of the disparity, it seems difficult to unpack the social construct of disability from experienced disabilities and the sense of hindrances. How much of the absence of people with disabilities in the sciences represent the presence of people who don't self-identify as disabled despite having problems that make work harder for them?
That was a big question. Okay, so I'm trying to think through the question. So how much of the absence of people with disabilities in the science represent the presence of people?
Let me reread this for a second.
Thank you. Yeah,
how much of the absence of people with disabilities in the sciences represents the presence of people who don't self-identify as being disabled, despite the fact that they do indeed have problems that make it very challenging to work?
Got it. So I think if I'm understanding this question, and I apologize, please let me know if I'm not understanding it. So it's about self-identify, right? And so how many, again, if I'm understanding this question correctly, do we have people in the sciences not identifying as having a disability? And my answer is 100% we do. We absolutely do. Those data I showed you are absolute underestimates, right? Those are people reporting disability, right? It is that social construct as was indicated. And so the point being, there may be lots more people out there who have, vision loss or low vision, who may not identify as having a disability based on some of the questionnaires, and therefore are still having barriers to their career, to their research, or even on the other side as being included in science as a participant, 100%, right? So the problem is, when I get this kind of a question is multifold, to dig into this a little bit. When we ask people on surveys around their disability status, it's not just, do you have a disability, yes or no? That's as an epidemiologist, that's not a great way to ask the question, but I always get some kind of pushback of, oh, no one's going to want to disclose that. No one's going to be honest with you. But it's right there. It's at that point that I push back. Society has created that, right? That fear to disclose, that hesitation to, in an anonymous survey, say that, I have difficulty seeing, right? Society's created this. And this is such a deep, deep inequity and marginalization that people are afraid to even disclose it on a survey. Imagine if you were afraid to disclose your gender or your race on a survey. And I know some individuals certainly still are, but it's similar to that, right? We have to change the system, change the way we think and talk about disability, the way we include disability. And then I think more people will both report and more people will come to the space, if that makes sense. So I'm not sure if I completely answered the question, but I know we're undercounting. I know we are.
I think that addresses it. And unfortunately, I think in the interest of time, we'll have to move on. But I would encourage people to listen to your podcast and to go to some of the resources, because clearly this is, as you say, it's a deep dive, right? There's a lot of depth to this issue that we just haven't started to grapple with, and that's important for all of us to be aware of. Also, I would encourage people to check out your website or your lab, just so we can see the science too. So that's